Everyone feels nervous sometimes. But what if the fear of being judged never fades and starts running your life? What's normal versus what's not? Feeling anxious in new situations is normal. Starting a job, meeting new people, or speaking publicly can trigger nerves, and that anxiety often fades with familiarity. But for some people, it doesn't fade. Instead, it stays intense, persistent, and disruptive. That's when it may be social anxiety disorder. What social anxiety disorder is? Social anxiety disorder is a recognized mental health condition involving a persistent fear of negative evaluation in social or performance situations. According to diagnostic criteria, the anxiety is out of proportion to the situation, lasts 6 months or more, interferes with daily life, work, or relationships. This goes far beyond ordinary shyness. Why it happens? There is no single cause. Evidence shows social anxiety develops from a combination of genetic vulnerability, such as family history, early social experiences, including bullying or rejection, avoidance patterns, where avoiding social situations reduces anxiety short-term but reinforces fear long-term. Over time, the brain learns to treat social interaction as a threat. How it shows up. Symptoms vary. Some people feel anxious during small talk, meeting new people, or being observed. Others struggle mainly in performance situations, like presentations or public speaking. A common fear is that visible anxiety, blushing, shaking, sweating, will be noticed and judged. Most people with social anxiety know their fear is excessive, but that insight alone doesn't stop the anxiety. Severe symptoms and risky coping. In severe cases, anxiety can cause derealization, a feeling of mental detachment or unreality. Some individuals use alcohol or drugs to cope socially. Research shows this increases the risk of dependence and worsens anxiety over time. How it's different from other disorders. Social anxiety disorder is distinct from generalized anxiety disorder, which involves broad, non-social worries, or agoraphobia, which centers on fear of being trapped or unable to escape. In social anxiety, the primary fear is negative judgment by others. Treatment that works. Social anxiety disorder is highly treatable. The most effective long-term treatment is cognitive behavioral therapy, or CBT. CBT helps people challenge distorted thoughts, reduce avoidance, and retrain the brain's fear response. Medications, such as SSRIs or SNRIs, may also help, especially for moderate to severe cases. Conclusion. Social anxiety disorder is not weakness. It is not a personality flaw. It is a well-defined, evidence-based condition, and it can be treated. If this helped clarify social anxiety, share it with someone who may need it. Like, subscribe, and remember, understanding anxiety is the first step towards reducing its power.